So thank you for joining us for the today's webinar. Let me introduce myself. So I'm Kalai Selvi, UN coordinator at Texla American University. Today we are going to discuss about the topic rising demand for cardiologistic in India for MBBS graduates. I'm glad to introduce the speaker of the day, Ms. Raja Rajeshwari, Assistant Team Leader for PG Cardiology Program in Texla American University. She is here. She have more than 5 years of experience in counseling the students and helps them to get into good career pathways. So today she is here to present on the topic rising demand for cardiologists in India for MBBS graduates. Over to you, Raji.
Thank you. So here we can see like the topic will be towards the webinar is the rising demand for cardiologists worldwide. So like I think as being a doctor, like everyone knows like what are the advantages for cardiology and so to become a cardiologist, like how much lifespan it has been taken, and there are many things. Okay, towards this particular lecture, I will explain you all what is the meaning of demand for cardiologist. Okay, so here we're going to see, first of all, what is cardiology? The cardiology deals with the disorders, condition, and treatment which has been related to the heart. And there are three types of cardiology. One will be the invasive, non-invasive, and interventional cardiology. And so here you can see like worldwide, there will be a many heart-related patients, and there are many heart disease like cardiovascular disease and rheumatic disease, like many things. And so due to this, the demand for cardiologist doctors are getting increased day by day. When it comes with the Indian Express report says that there are only 55 seats in cardiology and 104 seats in cardiovascular and thorax surgery, and were empty out of 1,907 seats in super specialty medicine. So as I mentioned you earlier, the types of cardiology technique will be invasive, non-invasive, and interventional cardiology. And what will be the invasive cardiology is a doctor like who's dealing with the surgery. So if the heart condition is one where the doctor will need to open up the body and work with minimally invasive surgery for identifying or treating the abnormalities of the heart structure, like angiogram, angioplasty, like dealing the patients through the surgery, that will be called as invasive. Non-invasive means the doctor will be not treating the patients through surgery. He'll be treating the patients through the medicine. That will be called as non-invasive. So if the heart condition is one that does not involve the use of fluids, needles, or other instrument for insertion to identify the problems. Interventional cardiology will be if the heart condition can be fixed by repairing the weakened or damaged vessels or narrowed arteries or such part of the body with the use of catheter. So that can be called as the interventional surgery. So only these are the three types of techniques which comes under the cardiology. So here one will be this, are the cardiologists or high in demand? Is there any shortage of cardiologists in India? So these are the two main questions every doctors will be having. Yes, definitely. So the cardiologists are really high in demand, and there is really a shortage of cardiologists in India. So when it comes with what is high in demand means, because as I mentioned in the first slide, I would have mentioned you, there are many cardiac patients all over the country, including India. But when you see the cardiologist doctors are very, very minimum, the cardiologist doctors will be just 11 to 11.2 percentage only. Okay, but when you see the cardiac patients will be n number. So there is a lack of cardiologists all over the country. So as being a cardiology in India is a medical field which is facing a severe shortage, and recent data has shown Indian citizens are at risk of being affected by heart diseases. In such a situation, the demand for cardiologists is bound to rise. Estimate for heart patients in India stand at 30 million, but cardiology in India is not a very popular field among the medical aspirants. So this shows what the future of cardiology in India lies in danger. So this is especially alarming since India is home to patients who are at high risk of heart diseases. There is a high demand for cardiologists in India when one looks at the figure of the patients. So here you can see how demanding the cardiology, and we have a shortage of cardiologists in India. We require many cardiologist doctors, okay, to come upon in this 2023. India needs 88,000 cardiologists, but we have only 4,000 cardiologists. So we are lacking like towards 90%. 28.1% of death in India are due to cardiovascular diseases. So normally when you see 4,000 to 4,500 cases for cardiovascular diseases, ischemic heart diseases, 1,750 to 2,000 cases, strokes 475 to 550 cases, rheumatic heart diseases, 550 to 674 cases. Okay, you can see like how much cases is coming of related to the heart. So you can see how much doctors we require, but we don't have that much doctors in India. How to become a cardiologist? Here you can see if you want to become a cardiologist, there is only 3 pathways. The one pathway is MBBS you want to complete. After that, NEET PG, you want to clear it with a good ranking. Then you want to go with MD seat. Then after completion of your MD, you want to clear your DM examination for DM cardiology. Then you become a DM cardiologist, which takes 11 years of lifespan. But do you think this 11 years of lifespan is right? No. Currently, what is happening is after completion of your MBBS, you try for NEET PG 2 or 3 times. After that, you get an MD seat. And that MD, you want to get it towards the internal medicine or chest medicine. There are certain specialty. If you want to become DM cardiology, you want to choose only certain major specialties. So after finishing your major specialty in MD medicine, after that, you want to crack your DM examination. After clearing your DM examination, then you want to pursue DM cardiology. Definitely it go with a lifespan of 15 to 18 years. If you leave this pathway, okay, it's very, very long. What is the other way? MBBS, again, NEET PG. You want to clear your DNB examination. But what is the DNB passing ratio? That is also very low. So DNB cardiologist also is quite difficult. Then how to become a cardiologist? That is why Texila provides you the opportunity of MBBS, and we give you, as being an MBBS graduate or an MD graduate, if you want to become a cardiac specialist, we provide the program of fellowship in clinical cardiology with critical care. And how this program is going is, how much does a cardiologist make? So this is one question everyone will be having in their mind. The salary of a cardiologist, you can see $3,35,841 to $5,04,458. That is the huge salary which has been bought by the doctors. But there is many. Okay, because maximum DM doctors get more salary in this. Okay, this is a sample report which I am provided for you. Okay, but here when it comes in Indian currency, as a senior cardiologist, a doctor earns in between 1,50,000 to 2,50,000. But it is not only up to 2,50,000. If you become very good experienced person, if you work as a consultant, and after that more than more, okay, then you can expect a very good salary, more than this particular level. Highest starting salary by specialty in 2017 to 18, the ratio is invasive cardiology, but the same ratio is being followed in this 2023 also. By 2022 to 23, the invasive cardiology doctors are earning more than the dollar of 10 lakhs, higher than this. Okay, which is really a great one. So why there's a shortage of cardiologists? Less number of DM seats. PG NEET, you want to clear it. If not, you'll not be able to pursue your MD or whatever the PG program. Longer period of study, low DNB passing ratio, 10 to 15%. This is the reason of the main shortage of cardiology. So we offer a fellowship in clinical cardiology with critical care to become a cardiac specialist. So here, why you choose fellowship in clinical cardiology is we don't require a NEET PG examination, hospital-based teaching, a very good hands-on training with a very good faculty support from the hospital and university. You can get it. Very good stipend, dedicated student mentor from Texila, a flexible location you can choose for pursuing this cardiology. And hands-on training in this particular premium hospital will be semester-wise, we have been differentiated. So you'll be into this particular, you'll be posting. So the clinical rotation, you'll be posted into the cardiology wards, cardiac ICU or emergencies, echocardiography, cardiac cath lab and Holter, stress test or nuclear imaging. So there are many departments you'll be posted while you're into the training in this particular premium hospitals. So these are the location I mentioned you earlier. We have it in Andhra, Gujarat, Delhi, Jaipur, like many locations. We offer this particular cardiology program, and where these particular hospitals, it's a very premium hospitals, and the faculty will be very good, very supportive, and the training, you can have a very good training. So TAU credentials will be International Association of University, the Global Compact, the Association of Commonwealth Universities, International Centers, and International Association for Medical Education. What our students say about us? So here you can see certain feedbacks. Many doctors has been mentioned with a very good opinion stating good education basis given by Texila. Great faculty and support, very good student mentor, a very good opportunity to develop our skills, a very good FSA lectures are very satisfying. So many feedback is given here. So you can see here, this is a real feedback. There are many graduate doctors have given a n number of feedbacks. Okay, because the main thing is when you're pursuing this cardiology, the training will be very, very good for you. So the training will be really good for you completely. And the main thing is, as being a cardiologist, like when you're pursuing in this Texila, the clinical is very, very important because wherever you go, the clinical only is making you to sustain. Okay, with if you have a theory knowledge is one part, but a clinical practical training is very important. When you choose a cardiology field, a practical training is very, very, very important. So that is given by Texila. And if you want to become a cardiologist, you can join Texila. Thank you.
Yeah, thank you, Raji. Thank you for your valuable time.